Good morning. Thank you for being here. I'm seeing some familiar faces and some new faces. That's always great. It's a pleasure to work with all of you. My name is Casey Camacho. I'm the Public Information Officer for Sacramento County Public Health. And this press conference is being held today to provide information on a recently confirmed measles case in Sacramento County. The message today we want to make clear is that measles is very serious and very preventable by way of vaccination. Vaccination is the most effective way to protect yourself, your family, and the broader community. So today we have Dr. Olivia Casirier, our Sacramento County Public Health Officer. She's going to share a statement with you all that contains the most up-to-date information on the case, as well as some preventative information on how we can protect our community as well. After Dr. Casirier's remarks, we're going to hold a brief Q&A so you all can ask some questions. We'll hold some time for that. And then we'll conclude the press conference. If you have any questions thereafter, I left business cards on the back check-in table, and you can feel free to reach out to me directly. Most of you already have my contact information. With that, I will turn it over to Dr. K for her official statement.
Thank you, and good morning, everyone, and thank you again for being here with us. My name is Dr. Olivia Casirier, and I'm the Sacramento County Public Health Officer, and I'm here to talk about a recently confirmed measles case in Sacramento County. And before we get into the specifics, I just wanted to emphasize again that Sacramento County Public Health's top priority is to protect our community from measles. Measles is a very serious and highly contagious disease, and the single most effective way of preventing its spread within our communities is through vaccination. So some facts about the case. We recently confirmed a case of measles in an unvaccinated child who recently returned from international travel. The child developed symptoms after returning to the United States and was seen at Mercy San Juan Medical Center on June 10th. The child is currently recovering at home. We are not aware of any additional cases at this time. While infectious, the individual visited the emergency department, as I mentioned, at Mercy San Juan Medical Center on June 10th between the hours of 5:11 p.m. and 9:45 p.m. Those who were at the emergency department during that time may have been exposed. The hospital is working closely with public health and has notified affected patients and staff. They are also taking immediate steps to ensure and prevent any further spread. A healthcare provider alert was also distributed to our regional healthcare providers to make them aware of this case, and again to remind them of the importance of identifying cases quickly and making sure that appropriate steps are taken with isolation and notifying the health department. This individual does not pose a risk of measles to the general public outside of those present at the facility during the specified date and time. Anyone who was at the above location, Mercy San Juan Medical Center, during that date and time listed may be at risk of developing measles and should contact Sacramento County Public Health. A trained public health nurse will be able to assess the individual's risk and also determine preventive steps such as a measles vaccine or other steps that might need to be taken. Anyone with measles symptoms, which usually include fever, cough, red eyes, and a rash that usually starts from the face and descends downwards, should stay at home and should call their doctor or healthcare provider before going to the clinic or going to the emergency room. Early isolation is very important in preventing the spread of this disease. This is one of 14 confirmed cases now in California for this year, 2025. 10 of which have been linked to international travel. And this case is consistent with the current trend of rising measles across the nation. the majority of which have been linked to unvaccinated individuals and also to international travel. We know that measles is preventable. 2 doses of the MMR vaccine are proven to be 97% effective in preventing infection. We are urging everyone to check their vaccination status and also update their measles vaccine if they need to, especially before traveling. Most health insurance plans do cover the MMR vaccine, and for those that do not have health insurance coverage, they should call the 211 number or visit sacvax.org to get information and resources as to where they can get the vaccination. I also wanted to mention that over the past few weeks, we have had intermittent positive results in our wastewater surveillance. And while this confirmed case has not been directly linked to these detections, we want to note that wastewater surveillance remains a critical new tool that we have right now to alert our healthcare providers when there might be a case of measles in our community. Finally, again, this case is a strong reminder of the current risk of measles in our communities and in our country at this time. And it's a good opportunity to remind our residents of the importance of getting vaccinated and preventing spread of this disease. By staying informed and vaccinated, we can protect ourselves, our families, and our entire community. And with that, we will take questions. Did you want to?
Yeah, go ahead.
I was curious, for those people who were exposed in the hospital, how effective is the vaccine after exposure?
Thank you. It's very important for the people who are exposed to get if they're not vaccinated, to get the vaccine within the first 72 hours. So as soon as we're notified a case, that's why it's really important for us to get notification as quickly as possible, because we have to move quickly to assess the status of the individuals that are exposed. And if it's within those 72 hours, then we can give them the vaccination. If we're not able to, the other alternative is that we need to monitor them for a period of 21 days, because that's the period of time in which they may start exhibiting symptoms.
Thank you. And would you just mind, if you're going to ask a question, stating your name and which outlet you're with?
Sure.
Again, yeah, one more.
You did. My name is Tori Apodaca. I'm with CBS 13. I'm also curious, who is most at risk? Is it children we're talking about, elderly folks, anyone?
Anyone basically is at risk if they are not vaccinated and if they are not immune. Children, especially those less than 5, and older individuals and people with chronic conditions are at greater risk of complications, and the complications might be inflammation of the brain or pneumonia, and these complications can lead to death.
Hi, Luke Clary, ABC 10. You mentioned that this case involves someone who is not vaccinated. What role do you think growing vaccine hesitancy has played in the rise in measles cases we've seen across the country? We've also heard some vaccine skepticism at the federal level. Do you believe that's making your job harder?
We have noticed a trend in terms of an increase in vaccine hesitancy, and definitely when there is a reduction in the number of people who are vaccinated, that does put the entire community at risk. In California, we do have a 95% coverage in vaccination, especially when we look at school-age children records. And that's about the level, 95% or higher, that you need in order to protect the community. The risk is that if an unvaccinated person does come from a community where there's a large percentage of people that are unvaccinated, then you might end up with an outbreak. So that's one of the things we try to prevent, is the further spread, especially in individuals that are not vaccinated.
And you mentioned the vaccine rates around 95%, but do you see that trending in any direction? Is it on a downward trend here in California?
It has held ready steady in California, especially because we have very strong laws that require vaccination for school-age children.
And the federal piece, has that made your job more difficult?
Luke, thank you for your question. We'll stop there and move on to the next person. Back to Tori.
On the trend of vaccinations, are measles one of those requirements to go into public schools? Is that one that's highly encouraged still in the state of California?
Measles vaccination is one of the required vaccines for entry into school.
And is there a recommendation as to what age range you should be getting that vaccine at? Are we talking about infants, 3 years old? I know it's 2 doses, I believe you said as well.
The vaccine is given in 2 doses. The first dose is usually given at age 1 year or 12 months. And then the second dose is given at 4 to 6 years, right before school starts.
I'm Rebecca Johnson from Sacramento. I know that you mentioned that there is no direct link to this case to the previous Measles sample detections. Is there then concern that there might be another Measles case that has not yet been confirmed, or
We do think that there is a connection, but we have no way of confirming that. Definitely, we continue to be on high alert because we know that we do have individuals traveling back and forth, especially when it does involve international travel. So we continue to do the surveillance, wastewater surveillance, and we also continue to work with our healthcare providers to make sure that they are on alert if a person does show up with symptoms that are suggestive of measles, that they will act quickly to isolate that person and also inform us so that we can also identify contacts and get them the appropriate evaluation and treatment.
In the back.
Christina with Fox 40. Do you happen to know what the vaccination rates are here in Sacramento County?
In Sacramento County, it is about 95%.
Okay. And then are you able to share the age of the child?
No, I'm not, sorry.
Are you able to talk about if they have any siblings that go to schools?
No, I cannot give any additional specifics.
Okay.
Brian Paul, KCRA 3. Are you able to disclose where they came from, the international travel?
No, I'm not able to.
How long since their return home did they start showing symptoms?
The symptoms started within about a week after they returned from the international travel. And soon after that, they then went to the emergency department.
Are there any other questions? Awesome. Great. Thank you, Dr. Kassiria.
All right. Thank you, everyone.